Polished death is a term I use a lot, and I actually practice what I preach. And what I'd like to do here is really give an analogy of an airplane landing and having that soft touchdown when the plane lands. It's that with a good death, a good polished death, that at the end of it everybody feels sad, but nobody feels angry, and the people are comfortable with it. Not to say that they're comfortable with death itself. You know, that's not that easy. It takes years. Some people never get over a death. My wife has never gotten over her mother's death. And it maybe wasn't quite as polished as it should be. Having that polished death where there isn't that anger, where there's grief and there's sadness, but you're not angry at someone. Well, I think the first way is to really get people's goals on the table. So I'm dealing with about 3 or 4 deaths right now that are in various stages. But one of them is a patient I've been caring for 2 or 3 years, and who has end-stage Alzheimer's disease. And she's just progressed and progressed and progressed. It's now at the point where she's aspirating. And she had an acute illness a couple of weeks ago, and I sat down with her husband and her 3 sons, and we talked about this, and we said, there are many things we could do. We could have her go in the hospital, we can get an evaluation there, we can start different medicines, there's lots of things, or we can keep her at home, and maybe our options won't be as great, but she wouldn't have to go in the hospital. And they uniformly said that that's what they wanted. They wanted her at home. So beginning those conversations and then saying, geez, what's possible at home, what's not possible at home. But it's getting those kind of what's most important to people on the table. And then the other promise that I gave them is that she wouldn't suffer. She would not suffer. So the point of the matter is that the primary goal has to be to reduce symptoms. And in a sense, you're cognizant, you're aware of some of the unintended consequences, but you put them on the back burner. You say, geez, our real goal is this comfort, this polished death, and if it means that it's going to be a death in several days as opposed to several weeks, we're okay with that.